Well, the president says Republicans don't have ideas. Is that true? House Majority Leader Eric Cantor joins us. Good evening, sir.
Greta, good to be with you.
Okay, so do you have ideas?
Absolutely, and the president knows we have ideas. In fact, we go back to 2009 when the ObamaCare law was passed. All the Republicans in the end voted against that bill, but we voted for our alternative. And in fact, the alternative that we had was even enjoyed a Congressional Budget Office score which said that our plan would actually lower the cost of premiums, unlike Obamacare.
Why is the president saying that? He said it yesterday in his speech. He says you have no ideas, you have no alternatives. I mean, why is he saying that to you?
Well, I think it's more of the same that we've seen from this president in the White House. It's just my way or the highway, and the public should just accept it. And that's really been the attitude that this White House has been about, and we see people are hurting now. And those of us in the Republican conference in the House really want to help people with their health care. And unfortunately, we know that Obamacare is just not ever going to get there. The website is just the beginning, because underneath it all is a flawed law that really is not going to give people the kind of health care that they want at the prices that they can afford.
See, here's what I don't get, is that last night I listed 3 programs that were suggested by the Republicans. They may not be good programs, they may be programs that no one likes, or they may be great programs. I don't know what it is, but they certainly were alternatives. They certainly were choices. And yet the president, I can't figure out if he doesn't know about them or if he's dismissive of them. I can't figure out why he says you don't have any. I mean, he may say they're dumb, but he doesn't. He says you don't have any.
Again, it's the attitude that the only thing that we can do is Obamacare, and all the while Obamacare is crumbling. You know, what we're seeing is people just are shocked, first of all, that they can't keep their plan that they were promised that they could. They're shocked at the premium increases. Wait till the deductibles start to hit in January. And so we have got a very serious situation, and those of us in the House believe much better prospects for a patient-centered plan.
Do you talk to him at all?
I've talked to the president, and again, I don't have a great opportunity to do so because the president really doesn't engage on the Capitol Hill. And that's part of the problem. And it's not that way with all those in the White House. In fact, I've had a great relationship with the vice president. I'm able to bounce ideas off of him. But unfortunately, somehow the communication doesn't always happen with the president.
Why? I mean, you're supposedly, you'd think they'd work together. You think he'd call you, you'd call him?
Well, I mean, at this point, perhaps maybe he'll begin to want to do that to solve problems, because if we can set our differences aside, there's a lot, I think, that we can do together. All of us care about health care. We don't believe that Obamacare is the way to afford that kind of care to the people. And in fact, the Congressional Budget Office, again, said that our approach, the one that's patient-based, the one that allows for more flexibility for health savings accounts, the one that says that people can purchase health care across state lines, and a plan, frankly, that had in it a safeguard for those with pre-existing conditions, but did not implement a plan that raised prices the way that Obamacare does. The president knows we have that plan, so it is a little bit baffling to hear the president say what he says, and I'm hopeful that he'll stop and he'll actually begin to listen to the kinds of things that many of us have been talking about, and frankly that we've all had discussions with others in his White House, but frankly he's not listening.
All right, let me ask you another question, Leader Cantor. We also want to get your thoughts on this, on what the Obama administration is calling an enrollment surge. They are apparently pleased that 29,000 people signed up for Obamacare in the first 48 hours since their November 30th relaunch. Of course, you balance that against the fact that overall 5.6 million have had their insurance canceled. But anyway, they are at least pleased with the 29,000.
You know, the administration likes to say that they're transparent, but what does 29,000 enrollees really mean? We don't know.
But even if they were enrollees into the, suppose it's from start to finish, they're paid and they're all paid up with insurance companies. Is that a good number?
Well, again, I would say we don't know, Greta. We don't know. We've had testimony in Congress on Capitol Hill saying that the backup of this program is not working, the back end.
Is it finished? I mean, do you know if it's even finished? Because I hear reports that it's not even finished.
We don't know. And in fact, we're hearing now reports of some kind of new temporary payment plan to insurance companies. Now imagine this. We don't have income verification systems in place. because the president delayed that portion of the law. We don't have the ability to say to insurance companies, this person is eligible for a subsidy or not. We're told now that the back end of the system doesn't do that yet. So what the administration, we are told, is about to do is to give taxpayer money to insurance companies on the honor system, to say, okay, here, you take that subsidy and you'll reconcile this with us later. Now, again, I don't think the public says that that's the right way for us to go about doing this.
If you're not communicating with the president, who's telling you this stuff?
Well, we obviously, as you just showed video after video, we have been very active in terms of oversight of ObamaCare on Capitol Hill. We don't have to go far. When our members go home into their district, believe me, we are deluged with anecdotes, with stories of hardship
but in terms
families
of
on ObamaCare issues.
The honor system, who's telling you about the honor system? It's the first time I'm hearing about this honor system.
Well, I mean, there was a report last night, and again, we don't know. So we're waiting for the briefing by the administration. But what we've been told now, and we need to verify this, but what we've been told is that income verification piece is not yet working, that there now has to be like a guesstimate or an honor system where I'm eligible for the subsidy, and oh, by the way, insurance companies take the taxpayer dollars and we'll reconcile it later.
Well, we don't know,
but I'm saying
the honor system didn't work in school very much, for at least where I went to school. But let me ask you one other question. Broadening of the GOP. You're going to have a big tent. I mean, how are you going to get a lot of people into this tent?
Well, there's no question that we need to, as a party, be about solving the problems that people are facing. And it is about jobs. We all know the chronic unemployed is growing in this country. Chronically unemployed. The number of jobs needs to grow. We need to talk about paychecks. I mean, we know that working middle-class Americans haven't really seen an increase in paychecks. Our conservative solutions actually are the ones that will help afford those ends for people. We have solutions to help bring down the cost of college. The way that we'll broaden the appeal of our party, frankly, is to talk about how conservative solutions are the answer. Because what we've seen now is big government at work by the Obama administration, and we've seen an economy that is lackluster at best, and we've seen a president that even today has been out there talking about how poorly the economy has performed under his watch.
Leader Cantor, nice to see you, sir. Thank you.
Thank you.